الجيدة. ندعو الآن الدكتور خالد لإلقاء محاضرته، فليتفضل مشكورا. تقدر تستعمل هذا المايك وتستعمل هذا المايك اللي تشوفه مناسب.
السلام عليكم ورحمة الله وبركاته. أولا فرصة سعيدة أن ألتقي بحضراتكم، وتعتبر هذه اللكتشر شرف إلي لأن يكونون الليسنر qualified and figure person in medical lab field and decision maker at the same time, whatever in public or private sector. Today I talk about emerging biomarker for the diagnosis or prediction of different diabetes type. In a few slides from this, I hope to establish a new concept about diagnostic criteria for diabetes. Diabetes is a family of disorder that is characterized by hyperglycemia, which lead to over time to serious damage to vital organ. Its effect on eye, as retinopathy, nephropathy, neuropathy, effect on heart and brain, Alzheimer, and delayed wound healing. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. So, World Health Organization estimate it was the 7th leading cause of death. Diabetes prevalence refers to the percentage of people over 18 years of age who have DM. The global prevalence of diabetes among adults rose from 4.7% in 1998 to 8.5% in 2014, and up to 40% it reached in 2020. This carry hidden message. If we look about from the 2014 to the 1980, the duplicate in prevalence is occur from approximately 5 to the 9. But the second duplicate from 8.5 to 14%, it's required just 6 years. In scientific explanation for this duplication in prevalence for short time come from two facts. The first, it is also an increase in diabetes prevalence. That is logic. But the second cause, it is the increase the technique that carry sensitivity and specificity by the availability of a new technology, like this device. The etiological classification for common and special types of diabetes is recommended by American Diabetes Association, International Specialized for Pediatric and Adult Diabetes, and the World Health Organization Expert Committee for promote awareness, make the precise diagnosis, and therapeutic decision. Most of them, when classified the diabetes, is called type 1 diabetes, type 2, and gestational diabetes. But if we hope and wish to make a therapeutic strategy fit for each person, we must not forget the special type of diabetes, because it's important in differential diagnosis, like LADA, latent autoimmune diabetes of adult, or called 1.5 DM, drug-induced type 3C diabetes, monogenic diabetes, including unital and moody. Moody is self-maturity of onset diabetes in youth. Itself is include 11 type, and Wolfram syndrome and Alstrom syndrome. Although it is rare, but it is recommended by scientific committee to take in account. All we know, we have the diagnostic criteria contain availability of tests in Iraq now. It is consists from fasting blood sugar and random, postprandial and oral glucose tolerance test, plus HbA1c. This is make differential diagnosis for diabetics now. But challenging between thrive or survive, decide how would be diabetes in the new millennium. What I mean by thrive with diabetes? I mean We can't cure or prevent happen of diabetes, but we can get diabetes with less complication, means increase in the quality of life. How increase the quality of life in diabetic patient? By decrease complication. How decrease complication? By take the specific differential diagnosis for each type, and so going to the therapeutic strategy for each patient. Type 1 diabetes is an autoimmune disease with a pre-symptomatic stage of variable length. Autoantibodies against pancreatic islet beta cell can be detected in the blood before any symptom of type 1 appear and are well-established biomarker of early disease. Here, in this figure, we show the diabetes is consists from 5 stages. We all, what's meant by we all? The patient and lab effort and physician work on stage 5, hyperglycemia. Hyperglycemia make the symptom and sign and then make the diagnosis. So we stand in 5 stages. We must not forget, when we reach to this stage, hyperglycemia occur, we suspected the patient to the complication of DKA, diabetic ketoacidosis, and it is not well think. It is contain irreversible pathological change. By using autoantibodies in DM, we can diagnose and predict the happening of DM in stage 3, normoglycemia. And the stage 1 and the stage 2, it is just the stage of initiation of disease. It is a combination or reaction between the genetic susceptibility and other environmental trigger. So we start in normal glycemic patient for make diagnosis and prediction. Towards personalized and precision medicine in diabetes, a new era of diabetology start. The scientists going from the basic discovery of islet autoantibody to the development and the standardization of bioassay as diagnostic tool. So we will delve into new glycodiagnostic test. بالحقيقة يعني أنا شخصياً قبل 10 سنوات من خلال الساينتفك اكاديميك ستدي كنا نشهد انه دائما البحوث مال بوست جراجويت كانت تتكرر على الجادا والاي اي 2 كلها اندر ساينتفك ريسيرش. Now we can declare for availability of this autoantibody with recommendation from scientific committee to use a differential diagnosis on approved device. ECA, islet cell autoantibody, specific autoantigen, and one of the most common islet cell autoantibody detected about 70 to 80% at onset of type 1 diabetic. If we see here, positivity for IK has been reported to increase the risk for a progression to type 1 in first degree of relative positive for GATA and for I2A. IAA, insulin autoantibodies, it is one of the autoantibodies tests that aim to evaluate the classification of different types of diabetes, type 1, type 1/2, and type 2. IAA test can be used for a predict of type 1 occurrence probability in the high-risk population. Also, it's used in controlling the insulin dosage in treatment and diagnoses the insulin function failure. GAD65, glutamic acid decarboxylase, is the earliest autoantibody in type 1 DM. Look, it is even before 10 years earlier than showing the symptom, it is appear. GAD65 autoantibody detection should be part of the diagnostic assessment for a clinically diagnosed type 2 DM because it's predict the rate of progression to insulin requirement in patients affected by the LADA, latent autoimmune disease. Insulinemia associated protein 2, A2, it is another test available now. It is a tyrosine phosphatase-like protein, also known as the ICA 512, is a transmembrane protein localized at the secretory vesicle of both endocrine and neuroendocrine tissue. They are directed against peptide fragment of 37 to 47 kilodalton, which are obtained after trypsinization of Langerhans islet homogeneate. Anti-IA2 antibody are found in 78% of type 1 DM at the time and prior of the diagnosis. This is a new test available called zinc transporter 8. Zinc transporter 8 cation flux transporter appear in approximately 60% of pre-diabetic and new onset patients. Zinc transporter 8 antibody were recently proposed as a new independent serological marker in type 1 DM. Zinc transporter 8 antibody distinguish TM type 1 and type 2, identify relative diabetic patient at most risk for developing diabetic. It is to predict the future need for insulin treatment in LADA. Zinc transporter 8 antibody predict the future development of DM in women with gestational diabetes. Zinc transporter 8 antibody predict the development of type 1 DM in patients with the Addison disease. It could be found in absence of anti-GADA and anti-I2A, so it is called independent serological marker. Proinsulin and C-peptide and insulin, somewhat if it is available, but it's also included in one device and in one profile. Snibe MAGLUMI diabetic panel, it is consisted from 15 items, 15 parameters. It is from GAT65, anti-IA2, IK, IAA, anti-zinc transporter 8, lactose, HbA1c, glycosylated serum protein, glycosylated albumin, and D3HB ketone body measure, glucose, C-peptide, insulin, proinsulin, and glucagon. While there are significant differences between types of diabetes, the shared goal among the scientists, healthcare professionals, and community advocated is clear: to improve the quality of life for individuals with diabetes and ultimately to find a cure. Thank you for your attending, our dear colleague. Thank you for Snibe company that manufactured this technology. With my best regard to you. Thank you for it.